is Steve Laffey's Fixing America. And now, broadcasting live from the Fixing America Command Center in Fort Collins, Colorado, here is your host, Steve Laffey.
Hey, good afternoon, America. Steve Laffey, Steve Laffey's Fixing America, and we've got a great show for you today. I'm very excited. The last couple of weeks, we've done a couple of shows on healthcare. Yesterday, we spent the whole day on Obamacare for a whole hour, and we gave you some ideas about how to fix this whole big, giant problem. And we're operating here at LaffeyRadio.com. It's Steve Laffey's Fixing America. If, follow us on Twitter at Laffey Radio, like us on Facebook, and we've only been doing this for a couple of weeks, and we've got thousands of people getting all the emails in. We got your questions. I think on Thursday we're going to be answering some of the questions that come in. That should be another unusual show. But I'm excited today because I don't get to often hang out with people who are trying to fix a part of the economy. Usually in my public life, I was dealing mostly with people who were destroying part of the economy back in Cranston. Running for the U.S. Senate, meeting with people and talking with people, running against people who were actively trying to destroy part of the American economy. And so some of the fixes come in giant solutions, and some of them come in little itty bits, and some are sort of in between. And today we've got a great guest for you. We've never had a guest before. No one's going to confuse me with Dick Cavett or whoever else, I'm sure, or Johnny Carson. I hope not Johnny. I hope Johnny Carson. That'd be a great idea. But we've got Dr. Keith Smith here today, and Dr. Keith Smith is the managing partner and the owner of the Surgery Center of Oklahoma. And you may say, well, what's so big about that? Well, there's a lot of big things about that. What he started to do since he started the place in 97, he's an anesthesiologist and medical doctor, and also a darn good businessman, it looks like. But he came up with, about 2009, with the idea of making prices transparent. And I got to tell you, I want to do a jig sitting here thinking about, finally, someone trying to make healthcare prices transparent, no different than me buying a loaf of bread, showing up at the gas station, buying an automobile, whatever it might be, where I can shop around, both on the quality and price, and get along that curve of price and quality, the best thing for my family and for me. And so I just think it's tremendous that he's willing to join us for a whole hour. And he's on the line right now. Dr. Smith, are you with us? Is that right? It's led. Dr. Smith, are you out there?
Yes. Can you hear me?
Yes, there you are. Dr. Smith, thanks so much for coming on Steve Laffey's Fixing America. We just overjoyed to have you on with us today.
I'm thrilled to be on. I'm happy to be with you.
Well, tell us a little bit. First, I just introduced you slightly, but why don't you just tell us what you're all about and what's going on with the Surgery Center of Oklahoma? And I'm really curious about how'd you think this up? Why did you initially start this program of making prices transparent?
Well, when we started the Surgery Center in 1997, we decided to do a couple of things differently. From the very first day, we decided we would never take a dime of government money, partly for philosophical reasons and also because of all the strings that are always attached with that. And we also decided that we would have price honesty, that we would say, here's what we do and here's how much it costs. And we've been doing that since 1997, and our surgery center became a haven for the uninsured and people that had high deductibles, and word got around that if you called and asked how much is it to get your hernia fixed, we would give them an answer. As time went by and we became more successful and our reputation for quality spread, we noticed that the insurance companies, the big insurance companies, didn't act like we thought they would. We thought that if we were cheaper and better, that we would be front and center and very competitive in the medical marketplace in this part of the country. And we found just the opposite. We found that the big insurance companies worked very hard with their hospital buddies to shun us and to engage in various tactics to make sure that it was difficult for patients to come see us.
What kind of things did they do to make it hard for you at the beginning? I mean, you started from, I don't say nothing. You were a doctor already, but putting this together, you started a whole business, which is something by itself. What did they do to make life harder for you?
Well, the first thing they did is they attempted to pass laws at the state level, certificate of need laws, things like that, where we would have to demonstrate some community need. Never mind, we were risking our own capital. Then there would be laws that would say, well, some portion of your income has to be derived, from these 8 sources. And so there were just various attempts to hamstring us. And then the insurance companies got in on the act by telling patients that if they came to our facility, that their out-of-pocket deductible coinsurance copays would be vastly more. So there were lots of it didn't matter that the hospitals across town were charging 10, 15, 20 times what we were. And so we just got fed up, and we decided, just like you mentioned in the introduction 4 years ago, we were just going to put our prices online.
And that was a shocker.
We were going to do that. Yeah, we were going to do it for lots of reasons. One was so that people that were getting their eyes...
Our listeners to know that if you go to Surgery Center OK for Oklahoma, surgerycenterok.com, you can go right to the pricing line right there. And I have it right here in front of me. And in fact, folks, people don't know this. I mean, this is so wonderful. I went just to the knee operations, doc, and I can see that anterior cruciate ligament repair is $6,790, $6,790. And you may not know off the top of your head, but that's pretty cheap compared to what I hear. And I've had friends who've had that operation. So it's right there online. You have a picture of a human body where you can click around. And of course, some of these operations are elective in some respects that you don't need them tomorrow morning. But when you put this up online, what was the next thing that happened? Did anybody, who reacted to that? I don't see anybody doing that.
Well, the first thing that happened is the Canadians started to show up.
Okay.
We thought that was very interesting because, they all have universal health care up there, but apparently they had a card in their wallet, but they didn't really have any access to care because they started traveling to Oklahoma City to have their surgery. And it's because of the pricing you see there. That $6,790 for an anterior cruciate ligament reconstruction includes the facility, the surgeon, and the anesthesia charges. So
wow.
It's all inclusive.
Wow.
No,
go ahead.
Yeah, so the Canadians started to show up, and then more and more of the people that we had been caring for in the Oklahoma area that were either uninsured or had real high deductibles, more of them showed up. And then the people from out of state started showing up. And we've treated patients from every state in the United States except Hawaii.
Wow.
We got the attention. Then we got the attention of companies that are self-funded, companies that basically pay for their employees' health care costs out of operating revenue rather than participate in the insurance scam that the rest of us have to deal with.
Yes, in fact, and you're talking about larger companies, for example, that just self-insure. In other words, they might self-insure.
That's right.
We did this in Cranston. We self-insured up to $150,000 for all 2,000. I was the mayor of a city, and that's how we did it. We self-insured to a certain number, and we bought insurance above that number. We would have been someone that, if I'd known you existed, someone who would have liked to send someone down here for some operations.
Well, in most of these companies and cities and townships and counties, they found that they can fly an employee and a loved one or a friend with them, pay all their lodging and travel costs and our surgery, and still be paying a very small fraction of what they would have paid at the so-called not-for-profit hospital that's right across the street.
Now, I imagine these Canadians, for example, because my understanding is there's like 1 million Americans who leave the country, whether it's Mexico, China. There's other places that people go, which I personally wouldn't even think about doing, to leave America to get an operation. But people do it now. I imagine that's how the Canadians were doing the same thing and found you along the line and said, hey, I'd rather do it in America. They're the best healthcare, doctors and so forth in the world, so to speak. And that's how they started to find you.
Yeah, that's true. I think that people that leave the United States that try to go have surgery or get their care, that number is going to dwindle because what we've done has gone viral. There are more and more facilities and physicians that are coming online, and even a full-service hospital here in Oklahoma City has joined us in this effort, which is very exciting.
Wow!
So you're going to have more and more facilities that are going to come on board, and some are going to do it because it's the right thing, and rather than engage in what can I get away with kind of pricing, which is typical in healthcare, they're going to do what every other industry in the United States does, and what we've decided we would do, and that is, decide what our costs are, build in a marginal profit, and be fair with people, and look them in the eye and tell them, this is what it's going to cost. The people who don't do this for the right reasons, they'll do it for the wrong reasons. They'll do it out of fear because they'll be sick and tired of seeing patients from New Jersey and Georgia and Florida and all over the place walk out and come to Oklahoma City to have their surgery.
Well, I'm wondering if you're not starting a revolution in healthcare with this transparent pricing, just simply by you have the price there. And I'm wondering if certain people, let's say I have a high deductible plan, I might just say, hey, to a doctor or to a hospital, I could go see Dr. Smith or one of the other doctors there. I've got to get this operation on my foot. I have a whole printed off all your foot operations. And then can you match it? I mean, people do that when they buy a car. They go to a Honda dealership and they might really like the guy there. They might have dealt with him for 20 years. But they say, Jimmy, the guy across the street's running a sale. Can you do the same thing for this price? And most of the times they say yes. Does that happen at all to you where you find out that people didn't come to see you, you didn't get the business, but you're still lowering the cost for America?
Yeah, I get dozens of emails all the time from people that say, I was going to come see you, but I threw your pricing, in front of my surgeon in the hospital, and I had a plane ticket to Oklahoma City in the other hand and told them they needed to step up or I was out of there. So we're causing a deflationary effect in the cost of healthcare here in Oklahoma City, but really it's beginning to spread all over the country. And I encourage patients to use our pricing as leverage. And most of the time, it doesn't work. Most of the time, just because the big corporate machine is just typically so arrogant, it doesn't scare them until it's really too late, and they see a bunch of people walk out. But I think the eyes are open, and this is going to roll, and we're going to see a real deflationary move in the cost of healthcare. And ironically, that is the opposite of the intent of this federal legislation. That's meant to increase the cost of insurance and health care for everyone, so we'll all beg for the sequel, single payer. Right. And I think what we're doing is really aimed at the soft underbelly of Obamacare. It's a very paradoxical and unintended consequence of Obamacare is to create a consumer market where the prices drop. I don't think they saw that coming.
No, but it's coming. Hopefully it's coming. And you're really one of the leaders in it. Let's take a quick break, Dr. Smith. It's Steve Laffey. Steve Laffey's Fixing America at LaffeyRadio.com. We're talking with Keith Smith. His website is SurgeryCenterOK.com, and he's transforming transparency and lowering the cost for all of us in America, and we'll be right back.
Stay tuned. Steve Laffey's Fixing America returns after these commercial messages.
It's 6:42 p.m. Time for Steve Plotto and his son Dylan to do the dishes. They talk about everything from the yuckiness of girls to the awesomeness of his soccer team. Sometimes they don't talk at all. Then, hey! The dreaded splash fight. It's Dad O'Clock, and it's the best time of the day. Because the smallest moments can have the biggest impact on a child's life. Take time to be a dad today. Call 877-4DAD-411 or visit fatherhood.gov. Brought to you by the U.S. Department of Health and Human Services and the Ad Council.
The call to serve. It has no sound, yet I have heard it in the whispered retelling of honorable sacrifices made by those who have served before me. The call to serve has no form, yet I have clearly seen it. In the eyes of men and women infinitely more courageous and more driven than most. The call to serve has no weight, yet I have held it in my hands. I will commit to carry it close to my heart until my country is safe and the anguish of those less fortunate has been soothed. The call to serve is at once invisible and always present. And for those who choose to answer the call, for their country, for their fellow man, for themselves, it is the most powerful force on earth. America's Navy, a global force for good.
I'm in almost every school bus and classroom. I go to school with your children. We say the Pledge of Allegiance together. You see me around the neighborhood and you tell me that I'm a pretty good kid. Well, I'm one out of every 5 children in America, and I'm struggling with hunger. This problem is closer than you think. My teacher tells me we can grow up to be whatever we want. I want to grow up to be someone who doesn't go to bed hungry. There's enough food in this country to feed everybody. Please visit feedingamerica.org today and find your local food bank for ways to help. Every dollar you donate helps provide 8 meals for kids like me, quietly struggling with hunger. Together, we are Feeding America, brought to you by Feeding America and the Ad Council.
And now, back to the Fixing America radio program with your host, Steve Laffey.
We have this insane system now where you need healthcare, you're the buyer, I'm the doctor, I'm the seller of healthcare, and somebody else pays the bill. Who the heck is going to shop for price when somebody else is paying the bill?
Soaring healthcare costs.
The healthcare costs are way too high.
If we do nothing to slow these skyrocketing costs, we will eventually be spending more on Medicare and Medicaid than every other government program combined.
Steve Laffey here. Steve Laffey's Fixing America. Great to have you back. We're talking here with Dr. Keith Smith, who's revolutionizing price transparency. Something, and we just heard the little mashup clip that we put together, talking about, you know, someone saying, who's gonna shop for price when someone else is paying for it? It's just human nature, and that's what we face in healthcare today. And even today, you know, 48% of people get it through their company. And that started after World War II. We're not doing a history lesson here at Steve Laffey's Fixing America, but after World War II, that's how it all started. And it just became divorced. People became divorced from the real cost of healthcare. In fact, to this very day, most people don't know the real cost of what they're doing. And therefore, a whole gigantic system got set up. And that system, much to the, no amazement to me, but to the amazement of some people, raised the prices of things. And now we face a country. We have a country where we're spending 17% of GDP on healthcare and getting not as good results as other countries. But one of the things that we're talking about today is price transparency. I'm on the phone with Keith Smith, Dr. Keith Smith. He's owns the Surgery Center of Oklahoma. It's surgerycenterok.com, and you can go to his website and see price transparency for the first time, maybe ever. And I couldn't find anybody else who was doing it. So Dr. Smith, thanks for being on with us. And I want to get back just to the beginning of. I'm a businessman. I'm a Harvard Business School graduate. I raise funds for people like yourself, even in the good state of Oklahoma. Many times at Morgan Keegan when I was in Memphis, mostly oil companies. No, I don't remember any doctors' offices and so forth. But we did help roll up doctors' offices with FICOR and so forth. But I'm always interested in a great entrepreneur. You know, you mentioned at the beginning of our conversation that you had the philosophy of never taking money from the federal government. And I know so many doctors, Doc, who are caught up now. And I got doctor friends in Rhode Island who they don't pay them for 180 days. I mean, the forms they fill out, what they go through, and the frustration of some great doctors that I know who have treated me, my partner in my movie Fixing America, that the great frustration is huge. But you started with a different philosophy. Tell me a little about the psyche of how you and your or somebody else you were with. How'd you start this whole idea?
Well, I went into private practice as an anesthesiologist in 1990. I was recruited to Oklahoma City to do primarily cardiac anesthesia. That's how I was trained. And the resource-based relative value scale big Medicare shakeup happened in the early 90s, and anesthesiologists were one of the targets of that.
Right.
And within 2 years of me being in practice, I was being paid about $285 for a 6-hour, open heart case. It was very difficult. So they really made it easy for me to walk away, because prices are just signals after all, and they were indicating to me, the central planners, what they thought my service was worth, and I sent a corresponding signal back that their evaluation was incorrect. And I just stopped dealing with Medicare, and I treated those patients free of charge. The other reason I did that was philosophical, because I increasingly saw that my accepting federal money was coming out of the pocket of my next door neighbor, who didn't even know the patient across town to whom I delivered the care. And so it felt like a robbery to me. Mm-hmm. So when we opened up the surgery center, we just decided we're not going to be a special interest. We're not going to be that doctor in the white coat that says, yeah, I'm a free market, limited government guy, and then the next day put on our white coat and go down to the steps of the Capitol and lobby for more money from the government. So we just decided we would be philosophically consistent and act like put our money where our mouth was, as free market, hardcore property right sort of entrepreneurs and businessmen, and it turns out to be the best thing in the world for the patients.
And I just want to stop just the show for a second and just tell people this is very rare. What most people do as Dr. Smith alluded to, and I have friends in the for-profit education system, but they get 80% of their revenue from guaranteed student loans. And they're very conservative, quote-unquote, guys. But really, they've taken their money mostly from the federal government. So for someone to become the Hillsdale College of surgery centers in America, to start and say, this was a big risk. This was an unknown in some respects. People weren't doing this, Doc, when you started with this. And now, how big is your operation? How many doctors do you have? How big is the square footage you have? How big are you right now?
Our facility is about 37,000 square feet, and we have 50 surgeons on staff, and we do anywhere between 600 and 700 surgeries a month. So it's a very large surgery center, one of the largest in the United States. Our rate of growth right now is so rapid that I anticipate we will be certainly one of the largest in the next 12 months.
Well, are you have your own building, or are you renting a building, or?
Yeah, we actually started operation in a very small, corporately mismanaged, kind of burnout surgery center that we just bought, and we assumed the lease on that, and then we expanded and grew so rapidly, we just built our own building that we all own and work in. Wow.
So when we try to compare your cost level as a businessman to say, okay, so how does he do it? And I look at the hospital that's mentioned, there's other hospitals in Oklahoma City, and you have doctors who actually go back and forth between both buildings, a regular hospital and your hospital, the Surgery Center of Oklahoma. What's the biggest cost reduction that I would find if I came to analyze the normal hospital with no price transparency and your operation?
Our costs that you see online, by and large, are between a sixth and a tenth of what you would see at the so-called not-for-profit hospital across town. And that's a great question. One of my favorite exchanges was Thomas Sowell one time with I believe is because the free market is largely not at work, because wherever the market is at work, you'll have an intense downward pressure on pricing, and an consistently increasing standard of quality.
Yes, and in fact, we've seen that in other industries. We'll play a clip later on about that. But for you talked briefly about the certificate of need, and I don't think people understand this. It's sort of a way of keeping people out. The CON is a term that's used.
Yes.
And I want to talk to you about that. But let's take a quick break and come back and talk about again how they try to keep you out. We're here with Dr. Keith Smith. He's keeping prices low for everybody out there. It's amazing what he's done. His website is surgerycenterok.com. This is Steve Laffey. Steve Laffey's Fixing America at LaffeyRadio.com. And we'll be right back after a quick break.
Stay tuned. Steve Laffey's Fixing America returns after these commercial messages.
Well, I finally did it. I opened a 401k.
What? Why? Just wait for the inheritance. We've definitely got a rich uncle somewhere. We're one call away from the winner's circle at the Derby, dinners with multiple forks, a vacation home in the country, using summer as a verb.
You don't actually think that, do you?
When it comes to financial stability, don't get left behind. Get tools and tips for saving at feedthepig.org. This message brought to you by the American Institute of CPAs, the Rhode Island Society of CPAs, and the Ad Council.
When I have an asthma attack, I feel scared. It's like tiny nails in the air poke my lungs. I start to cough. Sometimes my parents have to take me to the hospital.
Today, 1 out of 13 children suffer from some form of asthma, accounting for nearly 1/3 of all emergency room visits.
I feel like I'm choking. It's kind of like an elephant is on my chest. A little whistle sound comes out when I breathe.
But while your child may suffer from asthma doesn't have to make your child suffer. There are simple ways you can prevent your child's next attack. To learn more, log on to www.noattacks.org or call your doctor, because even one attack is one too many.
I feel like a fish with no water.
Brought to you by the EPA, the Ad Council, and this station.
I am an American soldier.
I'm a warrior and a member of a team.
I serve the people of the United States and live the Army values.
I will always place this first.
I will never accept defeat.
I will never accept defeat.
I will never quit.
I will never leave a fallen comrade.
I am disciplined.
I am disciplined.
Physically and mentally tough.
Trained and proficient in my warrior tasks and drills.
I always maintain my arms, my equipment, and myself.
I am an expert and I am a professional.
I stand ready to deploy, engage, and destroy the
enemies of the United States of America in close combat.
I am a guardian of freedom and the American way of life.
I am an American soldier.
I am an American soldier.
I am an American soldier.
There's strong, and there's Army strong. See what it takes at GoArmy.com.
And now, back to the Fixing America radio program with your host, Steve Laffey.
Dr. Robert Maloney is a pioneer in the field of corrective eye surgery.
I started doing LASIK in 1991 as part of the original FDA trial. So I've been doing it for 18 years, and I've done about 50,000 procedures. The prices were about $2,500 an eye, $2,000 to $2,500 an eye. And they stayed that way for a year or two, but then other centers started coming in, and the price went down because of competition, because a lot of people wanted it, and a lot of doctors wanted to offer the service.
Wow, that's Dr. Maloney talking about LASIK surgery. Another situation that years ago was something that simply wasn't covered by insurance. And so therefore, when the competition heated up, the prices came down, and you did know what people were charging. I myself have had LASIK surgery. It's one of the reasons I wanted to play that clip. I remember the prices starting to come down. Well, I should have waited a little longer, but I remember them coming down when I started to have it. It's Steve Laffey here at Steve Laffey's Fixing America at LaffeyRadio.com. And we're on live with Dr. Keith Smith, who runs and owns Surgery Center of Oklahoma. That's Surgery Center OK for Oklahoma.com. you should check out his website. But he's doing his part to make things transparent. And Doc, we were just talking before the last break about the certificate of need and how tough it is. I mean, you made it sound a little bit easy when we were talking, but these states make it very hard for someone to try to break through with something like what you're doing, which is providing transparency for America on healthcare costs.
Yeah, and basically the way it works is the facilities that are already in existence sometimes will get together and they will hear a rumor that somebody is going to open up a surgery center or an MRI unit or a lithotripsy center or a hospital, across the street. And they don't want that competition that Dr. Maloney talked about in your ad because they know what will happen. They know that they'll have to compete, and they know that it will have a downward pressure on pricing. So oftentimes these certificate of need boards are stacked with the people who'd be negatively impacted by the presence of a new competitor. And so there's just simply no way that any sort of certificate is going to be issued.
And so you got through this whole process, but you've seen, I mean, what is it like? You have the hospital, the normal hospital, I shouldn't say normal, the nonprofit, quote unquote, high expense that costs 6 to 10 times as much to do the same operation. But you have doctors that go back and forth from that hospital to your hospital. And so they can't really complain about the quality of your hospital, or do they try to? You have the same doctors in many cases.
No, they know better than that. Many of the hospital administrators and almost everybody in our state health departments had surgery at our facility, so they really can't talk about the quality. And I'm gonna change a little bit of what you said leading up to this, because it doesn't cost 10 times more to do these surgeries at these hospitals. Right. They charge 10 times more. Right. They just charge. I'm sorry. You're right. Correct me. Yeah. Well, and I mean, to drive it home, people need to understand that providing health care doesn't cost that much, but what we're being charged for it is another matter altogether. And you'll hear all the excuses of the big hospitals. Well, we have all these uninsured people coming in our emergency room. Well, that's why there's a crane in front of every one of them building on, right? I mean, you hear all these excuses, but they're making so much money. They're buying out physician practices. Yep. They're buying out competing hospitals. There's this great industry consolidation that is basically more, closer and closer to a monopoly every day. But the way we beat certificate of need here in Oklahoma is we beat it at the state legislature, and we still don't have certificate of need laws here in Oklahoma. Oh wow! And I would have benefited from it because I would not have had to worry about any future competitors. I'd be like a car dealer, that threw down a lot of money to open up a car lot and then went to the legislator and said, we can't have any more car lots in this town, or this town, might be without my car lot. I might not be able to compete, and I might go out of business, and and then I might not be able to stay here, and then this town would be without a car lot. It's the same argument. It's that silly. Restricting supply, driving up prices, and I wanted to, I just brought in a bill today, just as the bills I get from my insurance company, and I have a high deductible policy for my family. I have 6 children, Doc, and I'm self-employed. I'm doing this by myself here, and the stuff I've done the last several years. But I always look at the summary of claim, and every bill goes like this: how much was the expense? The total charge was $745 on one of these. Amount allowed by your benefit, $560. And then I usually pay all of it until I hit a cap. But if I'm part of a large group, I guess, one of the large, insurance groups. But it always irks me that someone just showing up would actually pay more or less. It would be the same exact price. I mean, a cost of doing business for whatever it is. This happens to be a doctor visit for my daughter and so forth. But why is it? What happens to the poor people that don't have the big insurance company behind them, and they just show up and get a bill? But it's radically different than even what I get. And then you're the next level of lowering the cost. Yeah, there's a concept in a scam that everybody needs to understand, and it's hard to explain, but it's called PPO repricing. So imagine the hospitals and insurance companies are both real happy with this arrangement where the hospital issues a $100,000 bill and the insurance company tells the large employer, we beat them up, we whittled it down to $20,000 and that's all we're going to pay. And we're going to make the hospital write off $80,000. Well, there's more to the story.
Okay.
The story is the insurance company gets paid a commission on the extent to which they can write down that bill. If you think about that, that perversely inclines the insurance company to seek out the most gigantic bill they can find.
So
they're actually asking the hospital, can't you charge us $150,000 because their commission could be as high as 35% on that fictitious savings.
So it's
the hospitals are tickled to get paid $20,000 on a $100,000 bill because they'll write that $80,000 off as a loss, and that helps them maintain the fiction of their not-for-profit status. They then take that amount and plug it in to this thing called the uncompensated care system. And so while they wave the charity flag with their right hand, they're fleecing the taxpayers with their left hand. So the hospitals get paid even when they don't get paid. In fact, they get paid more to the extent that they claim that they weren't paid. I call it a reverse Enron. So there's so many scams, and it's PPO repricing, uncompensated care, all of this stuff. And that's why you see cranes in front of emergency rooms, because they have all these people come in that are uninsured. They're going to get paid for every one of those.
You just explained something that I just didn't know. I thought I knew a lot about this. That's incredible. I mean, that's like a breaking national. People don't know this. The general public doesn't know this.
And that explains why the insurance companies didn't want anything to do with us. We thought, we're high quality. We take care of all the Division I athletes at OU, at University of Oklahoma and Oklahoma State University. We take care of all those guys and their sports injuries at our facility. Everybody knows our quality, and our pricing is great, and all the big insurance companies treat us like we've got the plague. And that PPO repricing is why, because by me saying, here's what I do and here's how much it is, all the guys that get commissions on repricing, they're out of business.
Wow.
Because there aren't any markdowns. There isn't any what they call claims adjudication. There isn't any of that.
We're getting a little. I just wanted to tell you, I told a story yesterday that when I was in Mississippi, I went to an urgent care center. This is 4 years ago. My in-laws live. And I took my daughter. And I never saw a doctor, Doc. It was a Saturday morning. I remember it well because a hailstorm came through and destroyed my pickup truck. But that's another story. So I remember exactly what happened. I remember we didn't see a doctor. The nurse practitioner left the room not at a hospital, by the way, at a very low-cost place in northern Mississippi. Low land cost and so forth. And I went back to Rhode Island where I lived at the time. And later on, I got a bill for it was like $700. And I called the lady on the phone, and I said, "Ma'am, $700." And this lady wasn't a nurse or anything; she was in the business side of the DeSoto Hospital, whatever it was called, big giant chain hospital. And I said, "Ma'am, I'm not paying this bill." And she said, "Oh, well, we have a whole thing for people who can't pay the bill, and so forth." I said, "No, I can pay the bill. I'm simply not going to pay the bill. We didn't see a doctor. I'll give you $50, and I tell you, that lady on the phone, she was totally okay with me not paying. She said, "Oh, okay, blah, blah, blah." Ended the phone conversation, and I never heard from them again. But from what you explained, somebody got paid.
Oh, yeah. Now keep in mind, there's a great book by the outstanding economist Thomas DiLorenzo where he talks. I think the name of his book is "The Unvarnished Truth About Government: Organized Crime," and in the book he talks about the economics of utility companies that have very high fixed cost. To get their business started costs a lot of money, but to add an additional consumer once the lines are out costs almost nothing. And that is the economics of hospitals. They have high fixed costs to get things started, but it costs very little to see an additional patient in an emergency room or in the hospital once the institution is up and running and the paid hourly help is present.
Wow.
So I would encourage people to keep that in mind, that it really doesn't cost that much to provide care.
On the margin.
And also for the naysayers who say, well, you get what you pay for, that sometimes is true in a market economy, but the only areas where the free market is involved in medicine really is plastic surgery and, as you pointed out earlier, LASIK surgery.
Yeah. Well, Doc, let's take one last break. I want to talk to you about Obamacare when we come back from the break. It's Steve Laffey, Steve Laffey's Fixing America at LaffeyRadio.com. We're on the phone with Dr. Keith Smith, who's helping all of us by making prices transparent at his operating center in Oklahoma City and at Surgery Center of Oklahoma, surgerycenterok.com. We'll take one more break. When we come back, and we'll finish up with Dr. Smith. Thanks.
Stay tuned. Steve Laffey's Fixing America returns after these commercial messages.
Picture this, your next trip, Utah, 5 national parks. First, Zion. You're walking, the ground rises, the ground drops, the ground becomes water. Next, Bryce. You're riding a mule. You're riding a mule under giant orange strip castles. You are not dreaming. You will not forget this. On to Capitol Reef. Take the scenic route, the really scenic route. Take a path you've never taken and see the stars for the first time. Now for Canyonlands. You're riding a bike. You're riding a bike on Mars. Now you're riding the rapids. Class 2, Class 3, Class 4, Classic. Arches, 5:32 a.m. Some things are worth racing the sunrise for. The horizon lightens. You round the corner. Whoa. This is Life Elevated. The Mighty 5. 5 iconic parks, 1 epic experience. Plan your trip at visitutah.com.
Training is about more than muscle. It's about inner strength. So I push myself. That's why I serve in the United States Coast Guard. I train with the best. A team that shares my drive and commitment. We collect intelligence, guard our shores against drug smugglers, and keep our waterways safe, because our nation expects more.
If you expect more, maybe you were born ready. Find out at GoCoastGuard.com.
So, Jacqueline.
Yes, Mom?
I wanted to talk to you about something and... Oh, wait. Hold on. I just got a text. Oh, there's another one. Wow. Busy me. So, anyway...
Oh, wait, Mom. I just got a message. My friends keep commenting on my comment. Oh, there's another one. So many comments on my comment.
Oh, I can't wait to watch TV tonight. Playoffs!
Hey, guys, check out my new video game. Pew, pew. Wait, Mom, what? Huh?
What? Hold
What'd
on.
you say? Wait a second, what?
This weekend, unplug. Take your family to the forest. There's nothing in the world like experiencing nature firsthand. Trees, paths, bluebirds, streams. Getting closer to nature can get you closer to your family. To find the forest nearest you, go to discovertheforest.org. Brought to you by the U.S. Forest Service and the Ad Council.
And now, back to the Fixing America radio program with your host, Steve Laffey.
State insurance regulators are criticizing one doctor's efforts to make healthcare more affordable. Dr. John Mooney charges his patients a flat rate of $79 a month at 5 of his AMG medical group centers around the city. The fee includes unlimited office visits, some tests, and in-house surgeries. The state insurance department says Mooney needs a license for the system and has told him to shut it down. Mooney says he is just trying to make healthcare affordable.
Steve Laffey here. Steve Laffey's Fixing America. That was a great clip. There's a guy, Dr. Mooney. He's up there trying to really provide insurance for people and get them the lowest price, and he's being shut down by state regulators. And we're on the phone today with Dr. Keith Smith, who runs the Surgery Center of Oklahoma And hasn't been shut down. He's got a very successful, thriving practice. He decided a long time ago to not deal with the federal government and to do it alone. And in 2009, he put on his website, surgerycenterok.com, the actual picture of a human being, and you can point and click and go to, for example, the knee, and find out how much a medical collateral ligament costs. That's $6,160. Or if you have something wrong with your foot, you can go on there and get I can't even pronounce some of these things, a bilateral bunionectomy, and that's like $6,000. But these prices are transparent, and it's like, and I don't mean to downgrade what he's doing, but it's like going to into AutoZone and saying how much for a can of oil, and you know what it is, and when you know what it is, you can make better decisions. And the problem we've had in healthcare, the problem that our politicians won't deal with, I mean, some will try to. In fact, the state of Oklahoma has a couple that will, especially Tom Coburn. But politicians won't deal with this problem. The lobbying power is huge, and now we face Obamacare, and that's where I wanted to get to with you, Dr. Smith, at the end. But tell us, you've watched Obamacare evolve. Tell us what you think about it, what we can do about it, where we are in it, and what do you think is ultimately going to happen?
Well, there's some things some thoughts I've had about Obamacare that may not be intuitive to people who are not inside of the system, particularly anybody who owns and operates a facility the way I do. But it's very clear to me that this bill was written to fail. It was written by the crony capitalists who would benefit from it. So just like everything else that oozes out of Washington, it's going to line the pockets of the players who were at the table and wrote this. And that's the big corporate hospitals, the giant insurance companies, only a few of which will be left when it's over. So they have a great consolidation that will make them all very rich. The electronic health records industry, big pharma, I mean, just all the usual suspects are going to make a lot of money. So, but the way they were hoping it would work, I think, is they wanted to drive the cost of insurance and the cost of health care so high that the whole system would crash, and we would all beg then for Uncle Sam to ride in and rescue us with the sequel, which is single payer. And the latest estimate that I read was that 129 million people in the United States will receive cancellation notices on their insurance. And so they're well along the way to accomplishing their goal. The other thing to keep in mind is that it's no mistake that price or cost of health care was never discussed during the Obamacare debate. It was all about making sure everyone had coverage. So that is no mistake. Now that the law is what it is, they will begin to talk about price. But at that point then, the reason they'll talk about price is rationing, because when everybody has coverage of some type and somebody else is paying the bill, it's like P.J. O'Rourke said, if you think health care is expensive now, wait till it's free.
Right.
The demand will be so high that the central planners they'll start to ration, and what they'll do is they'll pay physicians and facilities so little that they simply can't afford to do some procedures. And that is what the death panels are going to look like when people need care and they can't get it because no one can afford to render that care. So this bill is just more of the same crony capitalism that we see coming out of Washington. And when it's all said and done, they'll have 3 or 4 or 5 insurance companies, all of whose revenue will be derived from the taxpayers rather than willing consumers. They won't really have any significant competition. They'll just have guaranteed revenue coming in because the taxpayers are held at gunpoint, to get their premiums.
Doc, is there any way out of it now? What can we do besides electing new people, and how far down the road are we? Is there some hope?
I'm extremely optimistic, even having said what I just said, because paradoxically, what has been created is a consumer market, because if you find out that your insurance premium is going to triple or even higher in some places in the United States, you're going to respond to that by increasing your deductible and taking your own risk. Well, that means more of the money you spend on health care is coming out of your own pocket. And people spending their own money tend to ask the same question. They want to know how much is it, and they want to know up front. And just by asking that question, you create a very deflationary movement. And so there are entrepreneurs in medicine, just like in every other field, and we consider ourselves near the head, if not at the very head of the pack, because we'll tell people, and they'll say, I've got a $10,000 deductible now just to keep my health insurance premiums reasonable, and I can afford almost every procedure on your website within my deductible.
Right.
And so you're going to see more and more of this, and very, very, fortunately the government rarely ever gets it right. And this is another instance where, paradoxically, very unintentionally, they are going to create a consumer market, and I think we're going to see the actual cost and price of healthcare fall, and fall dramatically.
Wow. And that's because, as you were saying, is that, let's say my deductible for me rose from, if I had a $20,000 deductible, I would then start taking action. At some point, people start taking action to say, hey, wait a second. And by the way, I have done this. I'm a pretty aggressive guy. I've been and gotten bills back where I say, wait a second. This is not what the doctor did. Happened one time when I fell off my bicycle. The doctor didn't do these 3 things. Something's wrong here. And you know what hospitals do now? They just kind of talk to you twice. They send the bill out to some credit collection thing. I'm like, hey, I just want to talk to you about it. This was not done. There was no give or take in my case, and I know a lot of my friends' cases. But you think we could see, if we see prices drop, that's because the invisible hand of Adam Smith has a chance to work, I guess, with high deductibles.
It's because if you fall off your bicycle and you break your collarbone, and you take a picture of the X-ray with your iPhone and you text that to me, and I show it to a surgeon, and he says, hey, we can fix that for, I think, $4,825. And then I give you that answer, and the next thing you know, you're on a plane, and the guys who won't be straight with you like that are just left with their mouth open watching you leave town. So, yeah, we had a patient from Georgia last year who was quoted $40,000 for an operation on his prostate that we have listed on our website for $3,600. And so he threw down our price in front of his urologist and told his urologist, I'm going to Oklahoma City. The urologist called the hospital administrator and said, you're running my patients off. And the guy said, well, we'll do it for $4,000.
Wow.
So we saved the guy $36,000, and we didn't even do the surgery. So I think
that's the key.
You're going to see a lot. You're going to see a lot of that. You're going to see a ton of this, and I'm in the middle of it. When patients show up at the surgery center, I always ask them, "What's your next best price?" And I'm convinced we are already in the middle of a price war, and that's really what we wanted to start. We wanted to see free market competition in healthcare, like every other industry in the United States has to grapple with. The discipline of the free market is very unforgiving. In a government program, if you fail, you get more money. And if you own a restaurant that serves rotten food, you go out of business.
Right.
So
you've really been on. And we're getting near the end of the time here, but this is more of a mission than you. You're not really. I'm sure you like to make money, and I'm sure that you do well, and your family and so forth, and God bless you for all that. But this sounds like a man on a mission to help fix America in their own way.
Well, we can make more money doing things different ways, but it doesn't make it right. Just because, if Dr. Maloney, the LASIK guy that had his ad on earlier, he could have gone to the legislator and said, listen, don't let any other LASIK centers come in. Otherwise, I won't be able to keep mine open. I won't be able to afford this investment. I need some guarantee. I need some protection. And he would have made a whole lot more money, but it doesn't make it right.
Right.
Well, so we like we like to look our patients in the eye and tell them this is what we charge and feel good about it.
Well, God bless you. We thank you for being on the show. This has been eye-opening for me to speak about eyes, and we're at the end of our time right here. But I got to tell you, I'm going to come down and meet with you. I'm going to do a show from outside in front of the office one day, and we'll put you on. I'm not joking. I drove through there making a movie, and I'll do it again. But now we've got to go. So Dr. Smith, Dr. Keith Smith, that's Oklahoma Surgery Center. Check him out. I'm Steve Laffey at Steve Laffey Fixing America, and we're going to be back tomorrow with another show about another part of this economy that we can fix. God bless you. We'll talk to you tomorrow. Bye-bye.
You've been listening to Steve Laffey's Fixing America radio program on the Laffey Radio Network. Fixing America is broadcast Monday through Friday afternoons at 3 p.m. right here at www.laffeyradio.com. Any rebroadcast, retransmission, or account of this broadcast without the express written consent of Laffey Network, LLC is prohibited.